Hello and welcome to my channel. This is Pritesh Jadhav and today we shall be understanding a brief about nausea and vomiting. So without wasting further time, let's get started. Firstly, with the definition. Nausea refers to an imminent desire to vomit, which is often preceding or accompanies vomiting. Now, vomiting refers to a forceful expulsion of the gastric contents through the mouth. Retching refers to the labored, rhythmic respiratory activity that precedes an episode of emesis or vomiting. Regurgitation refers to a gentle expulsion of the gastric contents in the absence of nausea and abdominal diaphragmatic muscular contraction. Rumination refers to regurgitation, rechewing or reswallowing of the food from the stomach. Now let's get to know a bit about the pathophysiology of nausea and vomiting. Gastric contents are propelled into the esophagus when there is a relaxation of the gastric fundus and the gastroesophageal sphincter, followed by a rapid increase in the intra-abdominal pressure produced by the contraction of the abdominal and the diaphragmatic musculature. Increased intrathoracic pressure results in the further movement of the material or food to the mouth. Reflux elevation of the soft palate and the closure of glottis protects the nasopharynx and the trachea from the complete act of vomiting. Vomiting is controlled by two brainstem centers, the vomiting center and the chemoreceptor trigger center. Activation of the chemoreceptor trigger center in the medulla results in the impulses to the vomiting center, which is also present in the medulla, which controls the physical act of vomiting. Now we shall understand a brief about the evaluation of a patient of vomiting. The history, including a careful drug history, and the timing and character of the vomitor should be helpful. For example, vomiting that occurs predominantly in the morning is often seen in pregnancy, uremia or alcohol gastritis. Feculent emesis implies to a distal intestinal obstruction or gastrocolic fistula. Projectile vomiting suggests an increased intracranial pressure. Vomiting during or shortly after a meal may be due to a psychogenic cause or a peptic ulcer disease. Associated symptoms may also be helpful. Vertigo and tinnitus in Meniere's disease. Relief of abdominal pain with vomiting in peptic ulcer and early satiety in gastroparesis. Plain radiographs can suggest diagnosis such as intestinal obstruction. Upper GI series assesses the motility of the proximal GI tract as well as the mucosa. Other studies may be implicated such as the gastric emptying scans in diabetic patients, and the CT scan of a brain can also be useful in some cases of vomiting. Now we shall see a brief about the complications. Rupture of the esophagus, Borheim syndrome, hematemesis from a mucosal tear, that is the Mallory-Weiss syndrome, the dehydration, malnutrition, dental caries, erosions, metabolic alkalosis, hypokalemia and aspiration pneumonitis can occur with vomiting. Now the treatment. Treatment is aimed at correcting the specific cause. The effectiveness of the antiemetic medications depends on the etiology of the symptoms, the patient responsiveness and the side effects of the drug. Antihistaminics such as meclizine and dimenhydrinate are effective for vomit and nausea due to an inner ear dysfunction. Anticholinergic drugs like the scopolamine are effective for nausea, which is associated with motion sickness. Haloperidol and phenothiazine derivatives such as flocroperazine are often effective in controlling the nausea and vomiting, but sedation, hypotension and Parkinsonian effects are common side effects of these drugs. Selective dopamine agonists such as metoclopramide may be superior to phenothiazine in treating severe nausea and vomiting and are particularly useful in patients of gastroparesis. IV metoclopramide may be effective as a prophylaxis against nausea when given before chemotherapy. Ondansetron and granisetron, which are selective serotonin receptor blockers, and glucocorticoids are used for the treatment of nausea and vomiting associated with cancer chemotherapy. Aprepitant, a neurokinin receptor blocker, is effective for controlling nausea from a highly emetic drug like cisplatin. Erythromycin is effective in some patients of gastroparesis. If you enjoyed this video, please consider liking and subscribing to my channel to bring more such videos to you for improvement in your knowledge of medicine. Thank you very much.